Good morning, students. Myself, Jincy, lecturer from Emmanuel Archer College of Pharmacy. Today, we are discussing about the topic suppository. Suppository. These are semi-solid medicated dosage form of various sizes and shapes intended for insertion into body cavities other than mouth, that is, nose, ear, urethra, rectum, and vagina is known as suppository. These are prepared by incorporating the active pharmaceutical ingredients in suppository base, which then release the drug into fluids present in body cavities by melting to produce local or systemic effect. Then classification of suppositories. Rectal suppositories 1 to 2 gram, vaginal suppositories is a pessaries 4 to 8 gram, and nasal suppositories buggies 1 gram, urethral suppositories buggies 2 to 4 gram, ear cones 1 gram. Suppositories are bullet shaped pessaries are bullet shaped but larger, and buggies are long and thin. Then types of suppositories: rectal suppositories, vaginal suppositories, urethral suppositories, nasal suppositories, and ear cones. There may be five types. First one is rectal suppositories. Rectal suppositories, a torpedo shaped weighing 1 to 2 gram. Then vaginal suppositories, which means pessaries, globular, oviform, cone or wedge shaped, weighing 2 to 8 gram, made from glycerogelatin of microcool base. Then third one is urethral suppositories, thin pendle shaped, thin pencil shaped and pointed at one end. Male bug is 4 gram and 100 to 150 millimeter. Female bug is 2 gram and 60 to 75 millimeter. Then nasal suppositories, thin pencil shaped with pointed ends, 1.2 gram and 9 to 10 millimeter long. Then fifth one is ear cones, which is pencil shaped. Then advantages of suppositories: easily administered to children, elder person, and unconscious patients. Used in body cavities to produce local effect. Directly insert into rectum for rapid action. Unit dosage form of the drug. Drugs in suppositories are slowly absorbed and give sustained action, enhances the drug bioavailability. They are used for evacuation of bowel. Then disadvantages of suppositories. Written drugs cannot be administered by this route. Suppositories can cause embarrassment to patients as they have to expose their body for the insertion of suppositories into body cavity, required to be stored at low temperature, which may be 10 to 20 degrees Celsius. Cannot be prepared easily as it required specialist molds for preparation. Then suppository mold, available in different shapes and sizes, vary in number from 6 to 12, made up from SS, nickel, copper, aluminum, and plastic material. Open longitudinally by removing the screw. Then lubrication mold. It is done because suppository bases have property to stick to the side of the mold. Lubrication is done by brush or cotton wool. Also by pouring the lubricating agent into the mold is inverted in inverted position. In calibration of suppository mold, it is necessary because the size of suppositories remains same but weight varies. Then calibration of mold is done by prepare a set of suppositories, weigh the suppository, and then average mean indicates the true capacity of mold. Then displacement value. The volume of suppository from a particular mold is uniform, but its weight will vary because the density of medicament usually differs from the density of base with which the mold was calibrated. To prepare the suppository uniform and accurate weight, displacement value is considered. Displacement value is defined as quantity of the drug which displaces one part of the base. The displacement value of some medicaments used in suppositories with references to theobroma oil are given below. Drugs, namely aminophylline, boric acid, castor oil, phenobarbital, tannic acid, and zinc oxide. Displacement value for aminophylline 1.5. Then displacement value for boric acid 1.5. Castor oil displacement value 1 and phenobarbital also 1. Tannic acid also 1 and zinc oxide of displacement value 5. Then calculation of displacement value. Prepare and weigh 6 suppositories containing theobroma oil in required quantity. And prepare and weigh 6 suppositories containing 40% of medicament required quantity of. Then calculate the amount of theobroma oil present in medicated suppositories. Calculate the amount of medicament present in medicated suppositories. Then calculate the amount of theobroma oil displaced by d gram of the medicament. Then displacement value of medicament. The formula using d by a minus c. Then formulation of suppository. For formulation of suppository drug, suppository base, additives and packaging materials are required. Packaging materials include blister, strip and bottle packing as well as plastic disposable molds. Then method of preparation suppositories. The suppository mold is cleaned and lubricated properly with suitable lubricant. It is kept in an inverted position on ice bath to remove excess lubricants from mold cavity. The base is heated with continuous stirring in a porcelain dish on water bath to about 50 degrees Celsius. When the base is mixed with the drug with the stirring, the excess amount of mixture is immediately poured into the previously heated suppository mold and is placed on ice bath. After cooling to solidification, excess amount is scrapped and the mold is opened to remove suppositories. Then suppositories are then wrapped in tin foil or waxed paper and packed into suitable container. While preparing suppository, always weight of extra two suppositories is taken by considering wastage during transfer of material. For example, to prepare 8 suppositories, the amount of drug and base to be taken is for 10 suppositories. Storage of suppositories stored in a cool place, preferably in refrigerator to avoid melting. Then pessaries. Solid single dose preparations with various shapes, usually ovoid shape meant for introduction to the vagina, is known as pessaries. Larger than rectal suppositories and weight for 4 to 8 gram and may be conical and rod shaped. Available in tablet and capsule form are known as vaginal tablet and capsule respectively. Molded pessaries packed in container and stored in cool place. Instructions are given on label. Moist in the pessaries with water before insertion. Usage. Pessaries can be inserted using fingers into vagina, but for special shaped pessaries, applicators are provided to facilitate insertion into vagina. Sometimes instructions are given on the label to moisten pessaries with water before insertion into vagina to reduce the pain. Then storage. Pessaries are stored in a cool place. Quality control step 4. Suppository. Water content. Test water content. Microbial screening. Weight variation. Mechanical strength and disintegration test. Then melting point content, also content uniformity assay, in vitro drug release. Thank you.